The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to another episode of Speaking with the Senator. I'm Senator Kevin Avard, representing District 12. And today we're going to be talking with the Chief Operating Officer for the Easter Seals. And I want to welcome Nancy Rollins to the show. Welcome.
Thanks, Kevin. Thanks, Kevin.
So,
pleased to be here.
Well, glad that you're here. My introduction to asking you folks to come on the show was basically at an event that was happening in Manchester, and they were talking about jobs, and I never associated jobs with Easter Seals. Now I don't know why. I just know that you're an organization that helps with breathing, or
nope. We help people with disabilities and special needs.
Okay.
Broadly speaking.
Broadly speaking, right?
Yes.
I think there was one child though that you were helping that did have some really bad respiratory problems at some point. Maybe that was debilitating. But anyway, they were talking about jobs. And, you hire nurses, you hire across the field.
Across the field, from HR through our business administration, our IT, because technology is critically important for any nonprofit, but for particularly a large nonprofit like Easter Seals, both in terms of being able to use video conferencing or being able to keep records, healthcare records, and so forth. I mean, we're a pretty broad landscape.
So how many openings are there with you?
So we are constantly updating that, and you can go on our website to check what the local postings are. But generally, we have 12 core programs in New Hampshire alone. We do cover 3 states, Maine, New Hampshire, and Vermont. But our flagship, our prime administrative office, is in Manchester, on Lincoln Street in Auburn, which used to be the Tam O'Shanter factory for anybody who's been around for a while, like I have in Manchester. And we have 64,000 square feet as our primary hub there. And we have, we have 108 locations throughout the 3 states. And our core programs include early intervention services. So that may have been the person who had, or the child that had breathing, because we deal a lot with the 0 to 3 population, and they're doing special health care needs, assessments, and so forth.
Right.
And then we also have child development services, autism services. We have oral health program. We've got a very generous donation from Delta Health. And because of that, we've grown to having 5 chairs. We can provide services to a broad spectrum of people. We do sliding fee. We take all insurances. And we can address all of their oral health care needs.
So how do people take advantage of this? Easter Seals, or where do you go to apply to receive the benefits?
You can drop into our main office. You can call us on the phone. You can email. We have blogs, we have Facebook, any number of ways that you can communicate with us to find out about that. And certainly in all of those programs and the other programs that I can get into more, because we do community-based services for people who have developmental disabilities and traumatic brain injury. We also have workforce development services, and I'll come back to that in the context of talking about jobs. Yeah. We also have a military and veteran services program that we've provided for the last 10 years. Care coordination services to vets and their family members and their caregivers. We also have senior services. So we have across the lifespan, from little children to seniors. We have the service link for Hillsborough County, which includes Hillsborough North and certainly Nashua in terms of being able to access services, finding out what kind of benefits you can apply for and so forth. And if you're having difficulty with applying for Medicare or perhaps Medicaid or needing to look for a nursing home, ServiceLink helps with that. We have home care, where individuals, caring companions will go in and assist somebody who needs a little bit of help, non-medical help, but support in their home
Right.
so they can live there as long as they really would like to, which is what most seniors want to age in place. In addition to that, we have 4 levels of adult day, which really offers a great support for either
Adult day.
adult daycare or seniors who are they're in vulnerable stages of their lives. They may be in early stages of dementia or have full-blown Alzheimer's, so they need assistance, support, and safety. They need to be engaged socially. They need to be engaged in activities. So their husband, their partner, their whomever, adult children may be dropping them off for the day and picking them up. We also provide transportation. We do special transport services both for school districts as well as communities, Greater Derry, Londonderry. We've provided specialized transport there. And we also transport for our own programs.
Now, do you work with organizations like in Nashville, like Gateways, or?
We do,
Yeah.
because Gateways is one of the area agencies, just like the Moore Center. And so we're a subcontractor to those folks.
Okay.
So we may provide individualized services and a care plan in our community-based service. We may also provide housing services for them, day programs, and we also help get them employed. So much like the Plus Company and others, we're part of that broader provider network for that particular population.
So you must have a screening process, obviously, for your help and for the people that you're trying to hire.
Oh, absolutely. But again, you can go online and you can call our HR department, talk with folks. We do some screening. We do a lot of training. We also have worked with the New Americans populations through the community college system and have been doing specialized training for individuals who have basic English language but need additional assistance in order to understand the culture of working either in residential care or other services. So we provide that specialized training, and then we train them around how basically we interact with our population and so forth.
I went to go buy some tires today for my stepson. And there's a place on Canal Street here in Nashua.
Yep.
And the young lady answered the door and she said, "Now, my English is very broken, but I'm from Brazil, but I will do my best to help you." I thought that was really nice. You know? It's a discount tire store here in Nashua, but she was Brazilian, but the owner is Spanish. So I had to say de nada, and as thank you, and obrigado, all at the same time. So it was interesting, but it's nice to see that there's those type of services to acclimate people to the culture. That's important.
Well, and especially since many of the New Americans very much want to work. Many of the people who come to us looking for jobs and so forth, we're professionals in their own lives. And so now they're struggling to both adapt to a whole new culture, a whole new environment, a whole new weather. And so coming to Easter Seals, being part of that program has had profound impacts on their lives, but also on the lives of the clients that we serve.
Yeah, I remember there was a family up in the Franklin area, the Mohizis. They were refugees from the Congo persecution, Rwanda. So they were brought to America, and they really had nothing.
Right.
But the mother was a nurse, a professional, spoke 5 different languages. And so immediately we tried to help them get back into a productive lifestyle. And obviously everybody around them speaks American. There's a whole different lifestyle, and it can be overwhelming.
Absolutely.
Especially if you come from abject poverty like they did.
Right.
You look around and think everybody's a millionaire.
Right.
So adapting. So I didn't know you did these type of things. It's amazing.
That's what most people say. So last year alone, we served almost 30,000 people across the 3 states in 108 locations. We also provide residential services for juveniles involved in the child welfare or juvenile justice system or who need special education. We have several levels of residential care for that as well. That actually is where we have hired a number of new Americans, and also have a number of student interns and others who come in at sort of entry level, direct support kinds of positions. That's very helpful.
Now, are you funded at all by the feds, by the state, or just is it
All
all
of the
donation?
above. Nope, all of the above. So we access federal dollars. We have a very close relationship with the Department of Health and Human Services. We have numerous contracts through them. In addition to grants, foundation dollars, but we also have an incredible amount of fundraising.
Yes.
We do provide, last year, almost $6 million worth of free or subsidized services. Because even the funds that we get from the state or from the federal government do not necessarily cover the cost for a variety of reasons over time. They just have not caught up.
Are you engaged in the opiate crisis at all?
Yes. In 2008, we actually merged with the Farnham Center, which was a long-standing alcohol treatment center in Manchester. And Cheryl Wilkie, who is the director of that program, has just taken it, and we now provide full services at our Farnham Center on the Queen City, near the Queen City Bridge. We provide residential treatment as well as medical detox. We have transition services. We've opened a new outpatient center up on Lake Avenue, and then in Franklin, in what was formerly the Daniel Webster Orphanage that Alex Ray redeveloped over on 3A. We now have Farnham North there. So it was the convent and the orphanage.
Okay.
Do you know where I'm talking,
Yes,
on the river?
right next to the cornfield.
Exactly.
Yeah.
Exactly. Across from the
Farm.
farm.
Yeah.
Yes.
One of the farms.
There you go. One of the many farms. Yes.
Yeah.
So we're providing substance abuse treatment services as well.
Are you seeing success stories with substance abuse? I mean, there are a lot of repeat offenders, and people, addiction can be something that some people don't understand. Some people fall off the wagon, or they relapse. But if they stick to it, they can have a good lifestyle. Are you seeing success stories?
Absolutely, we have success stories. And as a matter of fact, if you go to our website, we have videos on there. People who are telling their stories much better than I can.
Sure.
Relative to what they've experienced and what a profound change that has been in their lives and how they've really reoriented themselves. So the services delivery and the team there are doing an incredible job.
So when's the next fundraiser?
Well, we just finished our annual celebration, but we have a number of fundraisers that are coming up this fall. Well, actually, we're now into the winter season.
Yeah.
And of course, we'll have our big wine spectacular in January.
And where will that be?
It's in Manchester at the Radisson.
That's right, okay.
Yeah.
Nice. So how did you get involved with Easter Seals?
Very good question, Senator. So I've been in Health and Human Services for now almost 45 years. Tell my age, but anyways. And I worked for the Department of Health and Human Services for 25 of those years in my professional career. My last gig there, I was the Associate Commissioner for Community-Based and Long-Term Care Services, and decided to retire in December of 2014. And I took a job with Goodwill Industries for a short period of time, and then Larry Gammon, who's the CEO and president of Easter Seals, came knocking and said, "Hey, Nancy, how about coming and joining our team?" Which
You
has
know
just
the
been
ins and
delightful.
outs, obviously.
Absolutely. I've always worked with Easter Seals, and I think one of the critical pieces to me was in my various roles with the department, whether I was at the Division for Children, Youth, and Families or working with children's mental health, whatever, Easter Seals was one of the organizations that when I always said, can we sit down and come up with some solutions? How can we better meet the needs of fill-in-the-blank population or clientele? And how do we do this creatively? So it's the power of the nonprofit community working with state government to find solutions, which I think is the best way to do it.
You have a little more flexibility, maybe, or to get things done?
In the nonprofit world, you certainly have more flexibility than we did in state government, just with rules and regulations. But I found my role at the department to be able to find how can we make these rules, regulations, and funding streams work for the people that really need the services.
Oh my gosh, yeah. I just, there was one young lady, she actually was a grandmother, or her mother called me. They're on managed care. and she's in one of the groups. There's Wellsense, and then there's Centene, I believe it is.
New Hampshire Healthy Families, yeah.
Yeah, and apparently her grandchild has a very acute disease that is rare. And this is one of those cases where it really is a life and death situation,
Absolutely.
and they got denied. And they're panicking, and because there's no doctor within New England that can take care of this, so they have to go to Michigan.
Wow.
And so, I'm vice chair of HHS in the Senate, and so she called and, Senator, I need help. And I mean, I had to go to the commissioner, and I have to go to, one of the organizations. Say, look, well, Senator, they got to make an appeal. And the process, on top of the fact that they're going through this, I mean, not even Boston takes care of this. And then there's a waiting list, 3-4 years, and the one in Michigan's 11 months. What's a mother to do? And especially when you're in poverty.
Yep. And you're desperate.
And,
Absolutely. You want to save your child.
It's and I'm sure I'll see more cases like this as time goes on. But it seems as though people fall through the cracks and they don't know how to get help. And I think there's help all around. It's just where to find it. And one of the nice things about being a senator is you can at least point them in their direction, make a contact, and be a bridge builder.
Right.
And because you can't be an expert on everything. I mean, you've been in the department forever, and it's a moving target.
It is indeed. It is indeed.
So, but it's nice to know that some of these folks can find help out there.
Absolutely. And one of the things I think we do really well at Easter Seals is care coordination, whether that's with our military and veterans and their families, but it is helping people maneuver through systems, whether it's the VA, whether it's the state government, or whatever. They are challenging, just as you mentioned before. And so having someone who can assist you in doing that, advocate on your behalf, and also teach you the ins and outs of how to become independent and be able to advocate on your own is critically important.
Oh, it is, and more you find people they just need a connection. They don't know where to go. I went to the department and they told me no, and they're lost. And it's just interesting. But I didn't know again that you did so many things.
Yes, and that's one of the continual things I find when I talk to people about, oh, you're at Easter Seals now, and I begin to tell them. I've talked to Rotaries, I've talked to other groups, and they go, wow, we really didn't know you did all of those kinds of things. And it's just terrific. We have a camping program. We are in, and has been running for well over 15 years. It's done in conjunction with the Boy Scouts up in Guilford. On the lakes up there is 3,400 acres, I think. It's quite the camp. We have our own facility there. And we take young people between 11 and 21 and give them a summer camp experience with the Boy Scouts. So many of the Boy Scout leaders, they might go to a site where there's the ropes course. The Boy Scout leaders are running it, and our students are participating in those activities. They come for either a week-long adventure or a two-week-long adventure. And I'll tell you, the Snowmobile Association strongly support that summer camp. And it's pretty outstanding, the things that happen.
So how do you keep track of that, being the chief executive operator?
I have great staff. We have a terrific senior staff. We have terrific executive staff. We work well together, challenge each other, but we also have a good time. But I think the most critical thing for me is we all believe in the mission, which is to help people with disabilities and special needs be able to have, their own lives.
Now, I believe in Concord there's the, is it the Foundation for Independent Living?
Yes.
Yeah.
Granite State Independent Living.
Yeah, and so you work along with
Yep. So we partner with those kinds of programs and do different services and so forth.
They've been before our committee a few times, and I don't think people understand that there are people out there that are willing to work, willing to be engaged, but wow, trying to get them just to allow them to the transportation to go shopping,
right?
So they can feel, and I don't mean this offensively, normal, right? Just out there in the community,
right?
Wanting to go shopping.
Absolutely.
And it is kind of a medical need, for the transportation to get out there. Because if you're stuck in one location, nobody's coming there to help you. I don't know if you're familiar with this issue, but it was just before our committee. Because it wasn't considered a medical service, they wouldn't provide for that.
Right. Medicaid wouldn't fund it.
Which is tragic, because then, well, what about their mental health?
Right.
You know,
They're socially isolated. They become depressed. Absolutely.
and that is a spiral. So it's and they just want to be part of the community. And I think if on all political spectrums, you can at least agree on this level. You know, that those that especially when they want to be part of the community, they want to work, they want to be independent as much as possible. Those are the people we can help.
Right. And as you know, I'm a native of New Hampshire, and transportation has been a significant issue for a number of years. And there are cities like Nashua and Manchester that have always had fixed route transportation. But it's costly, and it's always a challenge. But it's becoming an issue statewide, as we are the state with the second oldest population. We have people who want to live in their communities, seniors who are aging in place who don't have access to transportation. But for our councils on aging, who have a huge volunteer network, we wouldn't be able to provide people access to health care, to going shopping or whatever else. But then if the person is either not ambulatory, so in a wheelchair or whatever else, have additional challenges in those communities. And that's where Easter Seals would love to continue to partner with communities to talk about how do we help provide access, because we have over 140 vehicles, most of which are handicap accessible. They're special transit services.
Interesting. We just had ribbon cutting right next door to us just
Yes,
yesterday.
I saw the buses out
Yeah,
there.
brand new buses. It's like stepping on a Disney bus.
Yeah.
They look almost identical on the
And
inside.
the steps
They
drop
lowers down for
Yeah.
you. It's and there's compartments so you can put
Right.
in your wheelchair if you need to, or
Absolutely.
which is wonderful. And so I applaud the DOT and the people that are in charge of all that. And it's nice. So what do you need do you have certain shortfalls that you're struggling with right now?
So, as I said, we are always looking to hire, certainly people who can drive buses. That's an evolving process. Direct support workers.
What is that?
Direct support workers, it could be in community-based services where you're doing a one-on-one with a particular adult with a disability, provided them with day programs, providing them with support while they go to work or to other kinds of things.
You need like a degree like LNA or something like that to help?
Not for that, but we go through a training program, we go through an orientation, certainly want to support people so they knew what to do, what not to do. Some of our individuals do have medical complications, so we at least want to make them knowledgeable about what to do if somebody does have a medical episode of some sort. But we have people across the spectrum in terms of what we need for degrees or certification or other kinds of things. But I would clearly invite anyone to go on the website and look at our job listings.
And what is the website? I'm sure it's on our screen somewhere. I'm probably doing this.
EasterSealsNewHampshire.org.
Say it one more time.
EasterSealsNewHampshire.org. O-R-G.
Wonderful.
And it's a wonderful working environment. It's very welcoming, accepting. We
I
have
can tell
fun.
you like it.
I very much do.
Yeah. And it's
Part of the mission.
it does help. I was telling somebody the other day, we were talking about somebody getting their job back.
Yeah,
Those are little trophies.
absolutely.
When you help somebody, that's a trophy in life that you don't have to dust off, and that's sitting on the shelf. It's actually out there motivating. It's in the community,
Right.
and you can. It really does bring a smile to your face,
Right.
you know. And those are the rewards that are just they're a reward in themselves. And when you get that feeling, it's addicting. So that's a good addiction.
Absolutely.
So
And also, it helps not only them, their family. I mean, it
It's a
just
ripple
grows.
effect.
Absolutely. And many individuals will pay it forward so that a ripple continues even further.
So how do you find time to be a selectman? A select woman? How do you find time to do that?
I juggle a lot of balls, but I'm passionate about a lot of things.
Yeah. We were just talking about that, but whole idea of public service, I used to say, if you want a free education, right?
Yeah.
Bring your common sense to the table
Absolutely.
and just be engaged and watch how the process is made. Watch how a pothole is fixed or a fence or a setback is it's a wonderful thing. And if you
Right.
have time to do it, volunteer your time. And don't be just yapping at the TV saying, you know, they should be doing this. Get involved. But
Absolutely.
it's amazing that you're doing all that and this at the
Yes.
same time.
Yeah.
So, and this is your second term?
Yes. First year of my second term.
Oh, congratulations.
Thank you.
And thanks for coming on the show.
Yeah, thank you.
We really
It's
appreciate
been a pleasure talking to you, and thank you for taking the time to hear about Easter seals.
Well, glad to have you. So great. So if you're looking for a job, or if you want to get involved or help out, look up the website
Absolutely. EasterSealsNewHampshire.org.
and get engaged. You know, a lot of hands make the load light. So until next week, thanks for watching Speaking with the Senator.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.